there is October is coming, where they always talk about the knowing your numbers month, but don't wait until it's October. Just what is my body weight, what is my body mass index, what is my blood pressure, what is my blood sugar level, just to ensure that you are in good shape and you are able to. If you want to use the example of vehicles, you find car owners always go for a routine visit with their cars to the garage. They don't wait until it's too bad. It's true that there are times that you go that the car has a breakdown or something, but most people who are responsible car owners will go to the garage from time to time just to ensure that the vehicle is okay. They have to change the oil, and so on and so forth. So too with your health, you need to visit the hospital or have one mechanism. If you don't want to, we'll be talking about that later. If you really don't want to go to the hospital, then you should have some mechanism put in place to just verify and know that my numbers are okay, my heart is functioning well, my kidneys are doing okay. I should not run into some sort of trouble because I was ignorant of the fact that I'm like a ticking time bomb. So I think taking care of our health while we are seemingly healthy is very, very important.
All right, thank you very much for throwing more light on that. I would like us to look now at the other side when you said is you taking care of or being taken care of by somebody to restore that person's health or something like that. I want us to look this healthcare. Who are those to carry out the healthcare service?
Okay, health. When your health breaks down, I think the first people who identify and try to manage is always the people around you in the house. And we have a very beautiful system that we still believe in a family unit. So most people don't live alone, and even if they live alone, they will always call, I'm not feeling fine, can you accompany me to the hospital? That is when they can still talk anyway. If they have slumped and they are unable to, a family member will take them to the hospital. So I think the first carers are the people that we find around them. Then of course we have the professionals. We have the nurses, we have the doctors, we have a host of different professionals, healthcare professionals, who provide specific services to ensure that you are taken back to health. There is what we call the health illness continuum. It's like I don't know. There are so many people who don't like maths, but it's like the number line. So it's the health goes to one direction and you are never reaching there, and illness goes right to the other direction until it reaches death. So we are always oscillating between this. Okay. And when you move towards the illness side, the objective is to ensure that you are taken back to the healthy direction. And so we have the healthcare professionals that we have talked about. We have family members who act like carers, who also participate, and together we form a team that we ensure that we support you on your work back to health.
Thank you. These caregivers, how do they contribute to the recovery of a patient?
Okay, for the carers that we find in the hospital, who as I've said, mostly are family members, though the structures of our family presently is shifting slightly, because more and more the family members they may not be available round the clock. So we are getting to that point where you can actually pay a carer, pay somebody else who is not a family member to be your carer in the hospital. Whether it's your family member or is a paid individual who is not a healthcare professional, his or her own role is to assist you in some of those things that will naturally not be done in the hospital setting, because the healthcare professionals, particularly the nurses, are overburdened, are overworked. We have few nurses to so many patients. So it becomes very difficult for them to tend to your every need. That is the ideal situation, but we are yet to get there in our own setting. So we have carers who step in, who will bring your food, who who will assist to feed you if you can eat, because there is a point where it really becomes professional when you cannot eat and they have to place an NG tube and all of that. The professionals will handle it. But if you are able to eat, you know, your carer should ensure that they prepare the food that you want to eat and bring it to the hospital. They will ensure that you have clean clothes, because some of our hospitals, we don't have hospital wears, the patient gowns, and so you have to put on your own dress. So it is the responsibility of the carer to ensure that they change your dresses, they change your sheets when they are dirty, to ensure that the environment is clean. If you want to bathe for the patient that is not bedridden, because if the patient is bedridden, it becomes a professional activity, and so the nurses will have to step in to give what is known as the bed bath. But if you are able to move to the bath and get your and take a bath, then your carer should assist you to go to the bath, get a bath. The carer also serves as an errand person. As I said, we really can do better in a healthcare setting. I'm talking especially in the public sector, because when you go there, they will do prescriptions and you have to go and buy. So you can imagine if you don't have a carer, it will be challenging. Yes. So they have to do the prescription, they give to the carer will go to the pharmacy to go and procure the medications and bring. And if it is not in the hospital pharmacy, then they have to probably go out of the hospital to ensure that the medications are available. Are there lab tests to be done? They will write, you go and pay, and then ensure that you give the receipt where it is necessary. And so you find out that the carer is a very, very important team player, very relevant in our setting. We know that one day we'll get there where you bring your patient, you leave in the hospital, and you walk away. You walk away. Yes, it's done in so many of the developed countries. Yes. So you just come, and every other thing is taken care of by the very dynamic healthcare team. We are yet to get there. Our manpower doesn't permit us to do that for now.
Okay, you think it's only manpower anyway? Let's not go deep. Let's not go deep into that. But you just mentioned something that there are people that can be paid to take care of people, and also that even they are at home. Is it not risky for a sick person to be at home and then taken care of by a caregiver?
Okay, now it depends on what exactly you are sick of. There are certain patients who are stable, which means that they are not well enough to go about their activities, especially the elderly, and yet they are not too sick to be in the hospital. Now, these carers are people who also have a life to live. Mm-hmm. So if you have your daughter or your mother or your aunts or your niece who has been taking care of you in the hospital during your acute phase of your illness, and now you are stabilized and they think they can take you home so that they continue with their own life, I think it will only be fair enough to give them a chance to live. Mm-hmm. So on that note, you can be able to have a conversation with the attending physician and the healthcare team so that they see how it works out, how it will play out in the community. Do you have a group of trained individuals who can get into into your homes, in the comfort of your homes, and take care of you? Okay, if those people do exist, then you can be able to reach out to them and see that they continue with your care. These people are there to help in the continuity of care. They are not replacing any person. The hospitals, the clinics, they have their places, but as we have said, people who need continuous care, people who have life-limiting illnesses, people who are elderly, people who have some of these non-communicable diseases that always need regular checkup, there is no how they can remain in the hospital like forever. So the home also is the place that you can heal at your pace and heal in the comfort of your home, surrounded by your loved ones. Remember that the hospital also has a way of playing on a psychic, especially the elderly. So many of them will tell you, I don't want to go to the hospital. they don't like the scents, they don't like the lighting, they don't like those people in white. I remember my grandmother was here. I'm privileged to see her. My grandmother was here, and I had to take her to the hospital, and she simply told me that I'm not going. And her reason was that I'm going to meet some strangers who will be talking to me, and they will take one decision, and before you know it, they'll be injecting me. That is, I found it difficult to convince her to go to the hospital. So there are some people who are just in that space. They don't want to go to the hospital because they don't like those people in white. They are strangers. I don't like the smell of the place. Yes, of the hospital. I don't like the lighting. Somehow also the lighting of the hospital is always very bright to assist in the procedures that they have to do. So there are so many things that they don't like. They will prefer to stay in their home. And so yes, there are people, professionals, who can actually be able to close that gap and ensure that your care is not intercepted because you're not in the hospital, but you can continue your care at home. Definitely, they will liaise with the hospital or with the team to be able to give them updates on anything that needs their attention.
All right, thank you very much. You said there are people who are, but do we have that? Because I know in the Western world, we have that service that you're talking about.
Yeah.
They pay people. You just leave your dad or your mom or whosoever is sick at home, and there's somebody who comes in the morning, come and bathe the person, give the person food. But do we have that?
Yes,
I'm not sure.
Clara is here for that. So Clara is actually closing the last mile of care. It's ensuring that people who need care in the comfort of their homes, people who think that for one reason or the other they cannot be in the hospital, and will prefer to heal or to recuperate at home, Clara can actually step in. We have a sea of trained, qualified nurses who will step in to do that, depending on your needs. Remember at the beginning we were talking about being proactive in your with your health and being reactive. So one of the things that Clara does is to help people to be more proactive, which means that you don't need to technically go to the hospital to know your numbers. We can meet you in the comfort of your zone of your home at a time that is convenient to you, and then we actually check up on you, do an assessment, get your vitals, and ensure that you are in good shape. And at the end of the day also, we will want to give you a very individualized patient education or health education, you may want to call it. At times, because there are so many people in the hospital, we may give a group education. But when we meet you in the comfort of your home, it is you and your specificity, and we want to address that just the way we see it. So we are taking care of your health, we are giving you individualized education. So that is helping you to be proactive. And we are, of course, picking up red flags to tell you that, okay, at this point in time, we really think that you should visit the hospital, right? Remember I said there are scenarios where, in fact, I remember this unfortunate day. Should I call it unfortunate? I was in the hospital and they brought in a lady. She was on her way to the market. She stopped a taxi. On getting into the taxi, she slumped. So the taxi driver was like, Madam, enter, just to turn around and discover that she had slumped. So they struggled and put her into the taxi, rushed her to the hospital, and behold, her blood pressure was over 200. You agree with me that that is really a ticking time bomb. It's just some disaster waiting to happen. And of course, which it did happen that day. And Mama, are you hypertensive? No, I not get me high blood though. I no ever know say I get high blood. You understand? But imagine that we can visit you regularly and say, this is your blood pressure. The trend that we see is really getting on the rise. So we can begin by doing lifestyle adjustments. And if it's not responding to it, and we think that, okay, you now need some medication to adjust, that is a red flag that we have picked up early enough. You can go to the hospital, you can queue up without being agitated that they seem to are there for a year, it's no longer, it's not yet an emergency. And so you can be taken care of and you go home with nothing that is really spoiled, right? But when you wait until you already have a stroke, first it becomes an emergency. you are not too sure how many other emergencies you are going to meet there. And that is one of the frustration of people when they go to the hospital, the waiting time. They always think that the healthcare professionals are slow. They are not slow, they just have so many people to attend to. It's true that they will look at your condition and they may want to prioritize because this is more of an emergency one. But at the end of the day, even the more of an emergency, they have so many of them before you, and maybe the manpower or the personnel that are on duty, they can't meet up with all of that. That's something that you would have averted in the first place by just letting somebody follow you up to ensure that, okay, at this point in time, I think that we should take a break here. You go to the hospital, you give up a day, you go to the hospital, you do your lab test, and they check up and say that, okay, you can begin with medications or you can continue just with lifestyle adjustments, and we think that we are good to go. We should not wait until things are out of hand and we are being carried to the hospital. So I really think that the proactive healthcare is a way forward for every individual, and apart from that, it's a way forward. I think it is really cost effective because you pay a little token and you have somebody check up on you regularly. Unlike you wait until things are already out of hand, the bills now become so high, and worst case scenario, you don't know what your outcome will be. That is where that hidden cost comes into play. That you may say, okay, I will have all the money to pay at this point in time, but you're not too sure what the outcome will be. At times when you have a stroke, unfortunately, you have to remain with that sequelae at the end, throughout your life. And if you are somebody who has activities that you need to, it will be difficult and challenging.
But how, because so if you are taking care of a patient, I know they used to say the way you take care of a patient in the hospital or even at home, your attitude towards that person can also contribute to that person's recovery. How trained are these healthcare givers? They make one mistake that will cost the life of someone.
Okay, all right. If you're talking about what obtains on the Clara platform, I think all of the people that are there are trained and they are actually vetted before they are sent to the field. So we ensure that we go through their certification, all their certificates, first of all, to ensure at least that they have the training, at least 3 years of training. Then we support them. When you're on the field, you're not alone. And that's the conversation that we have with them. So you're not alone. There is always somebody that is just a phone call away. Okay, I was coming for just regular checkup for this mama, and I've discovered that her blood sugar today is at 400 and I'm at a loss on what I should do. You'll be guided. We also have short courses that we give to the nurses to ensure that they are up to their game. We believe that refresher courses are always very important. So we ensure that from time to time we do that so that they remain up on their game. So I think those are some of the things that we do to ascertain and ensure that the care is top notch. Not trying to, to blow the trumpet of Clara, but if you want to check up do the reviews, because we also try to do reviews for people who have used their services. I think so far they have been very, very satisfied, and most of them are the ones that are doing referrals and recommendations for the services. So far so good. I think that we have not had the challenge of the quality of care that is being offered.
Okay, let's go now to the hospital setting. Some of these nurses, like if you look around, even here in Korea, you see that majority, the population, those who are going to school, everybody is studying nursing, and there are so many of them. Even right now, there's the Ministry of Public Health is stepping in because of the lapses that we find in the field. So I want us now to go to the hospital setting. These nurses, at times, the way they treat patients has made it in such a way that caregivers or family members don't even want to leave their patient for 1 minute in their care.
It's regrettable if that's the opinion of the public.
It's not the opinion, it's a fact.
It's a fact that
it's a fact.
no, I beg to differ. That it is
Yeah,
a fact.
okay, because you've not witnessed it.
We may have one or two cases, but I don't think we should make it. We should take it as what is general.
Doctor, do you know how many people have called me and said we should discuss on how nurses treat patients in the hospital?
Okay, I'm not trying to be the advocate of the nurse here, but what I'm saying is, first, we do acknowledge that we have some bad seats. That, and if I say we have some bad seats, the next question I will ask myself is, so which profession does not have? Unfortunately, nurses, because they have to deal with patients at their most vulnerable time in their life, they get all the stones. They have to they have to critique almost everything. Even the people who are not knowledgeable about what needs to be done still think they have an opinion. And that is we always have conflicts of expectations. Those are one. Actually, we carried out a study on what some of the causes of the frustration of carers and patients themselves. One of the things is conflict of expectations. You come to the hospital, you are expecting that the nurse, if your medication is at 2 p.m., the nurse should be at your bedside at 2 p.m. and should give your medication. If you're supposed to eat, it is the place of the nurse to ensure that you have eaten. If you're supposed to say Cicela and blah 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 blah. Remember, I said where we are now, there is room for improvement. We can't say that we have gotten there, but there is room for improvement. It's regrettable if our services are not the best, but we know that we can improve. But some of those things, as I'm talking, your expectation, you have a particular view the way you should be treated. But remember, you come to the hospital and maybe in a ward you have just 1 or 2 nurses, and there's some people who cry, my treatment gave for dinner for 2 o'clock. You come now for 2:15 for can't give my, and it's a whole scenario in the hospital. They make plenty of noise. So you see that it is actually the expectation of the hours. But if the nurse explains that it's true you are supposed to have your medication at this particular point in time, but maybe at the time when I was coming, there was an emergency I had to attend, or there was a new admission that I had to attend to, or something. So those are, should I say, excuses that the patient does not want to hear. The patient knows that I am sick, I need to be taken care of, and so you have to take care of me. They don't want to also flip the coin and say that, okay, we have just 2 nurses on duty, and there is no how those 2 nurses can become 6 nurses at the same time. Especially when we have some of those patients who need total, what we call total nursing care, right? They have to make up your bed, clean you up, do your oral hygiene, ensure that your hair, you are kempt, serve your medication, change your position. I mean, they have to go as far as changing your position, total. You find out that if a nurse has to do that, it means that you will need 1 nurse for 1 patient. And of course, that 1 nurse for 1 patient will not be able to stand there for, I don't know, for the rest of the 8 hours, because it will still be exhausting. So you will find out that you may need, for 1 shift, you may need maybe 2 nurses for 1 patient. Is that the reality in a setting? It's not the reality in a setting. So the conflict in the expectations is one of the key things that bring about the frustrations of people in the hospital. There is so much that the nurse will want to give, to offer, but the nurse also finds his or herself with so many constraints. There is a proverb in Pidgin I love so much. Troki like boxing, I say hand shots. You understand? So they would love to give more of themselves, but they can only do what they are able to do. That said, as I've said, we also acknowledge that we have some individuals who are not rightly representing the profession. Not trying to downplay them. As I said, we always have them across different professions, and so we try to see how we can encourage them and work and see that they give better services to the population. I think that's our goal, to ensure that better services, in spite of what we have, in spite of our reality, we should be able to give better services. As I've said, there is room for improvement. We really can do better.
Okay, there's this other aspect that I would like us to discuss, like this caregivers, somebody taking care of a patient in the hospital setting.
Okay.
I know Clara can come to your home and take care of you. Let me look at the hospital setting now. We have cases where caregivers themselves fall sick and even get worse than the patient. Now, I think that in a hospital setting, the nurse or maybe the doctors, as they're taking care of the patient, they should know that the caregiver, all her attention, his or her attention is on the patient, and try to maybe counsel her to also take care of herself.
Yeah, very important. We have had cases of people who have taken care of their loved ones and then finally end up dying before them. So you're right. I think I will talk about that in two phases: the psychological aspect and the physical aspect. I've already tried to draw a picture of what it entails to take care of somebody who is sick. So it is physically draining. If you have to do a head count of number of health personnel, especially nurses, who are on what they call the lumbar belt because of back pain, you will sympathize with the nurses. They have to lift, they have to pull, they have to push, they have to, it is part of their duty. And you can imagine that the nurses are being taught how to position themselves in order to protect their lower back. The carer is not trained for that. So you can imagine when they step in and they have to do some of these things, it really weighs down on them. That's the first thing. It's exhausting. Your patient is sleeping and there are some hospitals that they tell you that you, even the caregiver, you are not supposed to sit on the bed.
That's
what don't you see what I do? So you're under the bed, they're tapping you from beneath the bed. I want to go peace. I want go, you know, and you have to intercept your sleep so you don't have any quality sleep. You have to get up, walk beside you. You don't have other hands that have to help you, that are out there to help you. Maybe you have to get up and think of how you're going to make money to buy the medications, or think of how you're going to get food, and then when you bring this food, the patient does not want, and it's draining. So it actually eventually takes a toll on the carer. The next thing also is psychological aspect. I don't know if you have your father or your mother or maybe a loved one that you have always looked up to. The picture that you have of that person is a healthy, jovial person. If it's your father, the strong person who protects, who provides, do you know what it means to live from that picture and see him go down the hill that he is unable to pee and you have to assist him? You don't want to go through that mental journey. It's difficult psychologically. It's very, very challenging to see your loved one, maybe your husband. You have always seen him as your lover. You've seen him as that person who will come home with goods, will take care of the kids, that you will discuss. And he's lying there on the bed, he cannot even talk to you. At times he gets up and he looks at you and asks, who are you? It does something to you. So psychologically also it weighs down on the carers. That's why maybe the people of the West think that for that reason they should protect these people and get professionals to do it. And that's why you have a team of professionals. As I said, you just come and leave your patient and you have nothing to do with them. The professionals, they have a way of just being professional, taking care of themselves, both physically, both psychologically, and just doing what they are called upon to do. You know, with Clara, I've had some nurses who have gone to, and they say, when I'm taking care of Papa, the mama seems as if she's not concerned or she's always angry about something. And the key question I always ask the nurse is, do you know the man you're taking care of is the lover of that mama, is the father to her children, is the confidant? And now the man is looking at her and morning, afternoon, evening, who are you? And then the child will come in to ask, and you ask again, who are you? he is no longer that protective. He is most vulnerable. It cuts right through the heart. That's why they need assistance. So yes, taking care of the patient has a way of weighing down on the carers, especially because they are not professionals. As I said, for the professionals, it's true that the professional, there is always, that's why anyway, when you do studies, you find out the profession with the highest burnout rate is the nursing profession. Because you take in almost all of these things, but then there are now ways that you are being taught also on how you can take care of your psychological space. Because imagine that nurse, I'm on duty, I take care of this person that I have established a relationship over the past 1 week, 2 weeks, and then the person dies. There is another patient that I have to move on to. And remember that I'm still a human being. So I have to sit down and process that before I'm able to move on. You understand? We don't work like robots. So imagine that that back and forth in your mind also takes a toll on you. But as I said, nurses being professionals, they are also taught of ways that you can be able to take care of your psychological space. Carers who may not have that is, but I love what you have just said, that they should always be incorporated and taken care of in the hospital. So this carer who is taking, of course, you should encourage them, you should hold their hands, you should allay their anxiety. At times it is just the lack of knowledge, not knowing, they put it, that fear of the unknown. You don't know whether this patient is going to get out of bed, or the patient is getting worse, or what exactly you are expecting. So at the end of the day, the carers, true, they also need to be taken care of.
Thank you. I really like that aspect that you've put out there, our hospitals, even if not to give them medication, or at least just to counsel them. Have you eaten? Make sure that as you're taking care of this person, you also have to eat, you have to drink water, you have to stay strong. Those things are very important. Okay, I want us to look at counseling now, because there are some people who go to the hospital, they are not really sick. When they go, they have that one-on-one. If they meet a doctor that can really have this one-on-one with them, laugh with them, you see that they get better. But this is something that, I don't know, let me not just conclude, but I think it's lacking in our system.
To say it's lacking may be an overstatement, because it's not readily available, but it doesn't mean that it's lacking. Yes, there are people who come to the hospital who don't need medication. They need just to have a conversation, and you allay their anxiety, and they are good to go, and they feel more empowered to face life's challenges, and they are good to go. And I think those services are there. We have the social service that is found in the hospital that that takes care of that. We have in some hospitals we have chaplaincies. Yes, that they can actually assign you to the different chaplain based on your faith, based on your belief. You can be able to have a conversation with them. We have psychosocial workers. So you see that, as I said, is a team, and everybody has his or her own specialty. So if you come and it is identified that you need just probably this therapy, we now have more and more mental health nurses also, that is part of their responsibility also. So they can actually talk with you, have talk sessions with you. Most often it's not just one session that is the magic one that will fix the scenario. So that's why you find out that you have a talk session and they'll give you another appointment. Clara does not have psychotherapists and mental health nurses for now, but we are looking forward to having that.
At least just the care that they give, they smile.
Of course, it is incorporated. If you look at our services that we always have, you find out that one of the aspects that is written there is what we call family care. As I said, we don't take care only of you, but we also turn around and say, this mama who is feeling so downcasted, what might be going on in her mind? How can we have a conversation to see that she can walk this journey without draining herself psychologically? So we definitely see how we can help them be more comfortable, help them to be more positive, even as they walk through this phase with their loved ones. Yes, so we address it because it's an integral part of the care that we give.
Okay, you are from the Southwest Delegation of Public Health, so you know much about health and all of that. Generally, I'm just asking you this question before you give a take-home message. What can you say about our healthcare services in the region?
Without wanting to be biased, I think that we are doing good. I've had an opportunity to work in different regions. I've had an opportunity to work in different hospitals. I think we are doing good. Given our manpower, given the structures that we have, I will say any day, any time. You know, I share a little experience. One day, my in-law, who is out of the country, came and then he said, I think he wanted to go to the hospital or something. And then I said, it will be difficult to see a specialist. He wanted to see a specialist. So I said, maybe you have to delay a little bit because the specialists are doing rounds. And he asked, what is rounds? I said, no, they go they go to the ward. They move from bed to bed, they discuss, so it is an interdisciplinary, so they discuss the situation. So it's not just because it's a cardiac patient, you have the cardiologist. No, you also have the nephrologist because the failure of the heart will eventually affect the kidney and all of that. So it's when I explained, he was like, okay, so you people do that. I said, yes, we do that. They take time and they go from bed to bed and ensure that all the patients, you know, they have the care that. And to him, it was a little bit strange because he, from his standpoint, it is like, you know, everybody, we go to the public. I said, no. As I said, to me, without being biased, I have worked in, that's something that you will not find in so many hospitals. True. You may not find it in so many hospitals. And when you find it, you may not find the same enthusiasm and passion with which we give them. And it comes back now to the issue of expectation that I was talking about. So you can imagine on these days of rounds that they have to go to the hospital, to the wards and see the patients. Think of the people who are at the outpatient department. They are frustrated because according to them, I have been here since morning and have not seen the doctor. But the doctor is taking care of another patient. The doctor is not on a safari trip. He is taking care of another patient and he can only be one place at one time. That's why I was saying that you said the population has a different view that is not only about manpower, but I think our problem stems from the fact that the manpower is not there. Because if we had people that they would divide and some are in the ward and some are taking care, that would be fine, right? But if we do not have, you can only have one person we are not omnipresent. You can only be at one place at one point in time, giving in your best to see that you attend to this person. Even the people in the ward can't hear them grumble because they started the things where they start for that ward, they know I can't reach for my own ward. Come on. And if they pass and hurry over a patient, that patient also will be grumbling, say they only can stand only 2 seconds. They don't come on. So you find out that it's a conflict of expectation. It's a conflict of expectation.
The patients too, they are frustrated. You know?
I understand, but also I said that at times, just for benefit of doubts, just tell yourself that these people are giving in their best. We don't leave our houses in the morning and we just say, I will go show that patient today. I will go remain from my office and not even consult them. That's not how a typical day of a healthcare professional looks like. We go and our desire is to see those people who are sick have the best of treatment and then be on their feet and go back home. Can you imagine a hospital with no patients? We also rest now. So it's not like we want to keep you there, but we can only work with what we have. And as I said, the conflict of expectation brings about that frustration. Because you are looking at your own patient, they should attend to your patient now. My patient is more serious. I don't know what parameter you use to judge that your own patient is more serious than that one. Or you are just saying that. And the other person, if they don't also spend appropriate time or adequate time, the other person will say, the doctor can see me, say, no, you can pass now pass. So the other person also is, and then will now be quarreling and grumbling and making a scene, and then this other, it's difficult. So, well, as I said, to me, in one word, I think we are doing good in the Southwest. Can we do better? Definitely, we can do better. There is room for improvement.
All right, thank you. We are running off the program. We've said so many things. I will just give you this opportunity to give us a take-home message, and maybe you throw more light on how people can get these healthcare services at their home.
Okay. Thank you very much for that opportunity. Thank you also for the wonderful interaction that we have had, and for the people out there who always feel frustrated when they go to the hospital. Have it at the back of your mind that healthcare professionals don't intend to do you any harm. They don't intend to make you feel bad. They want to give the best of themselves, but they can only do that to the best of their ability. At times, give them the benefit of doubt. Some of you, when you leave home, in your mind, you are already saying that if I don't go meet up that nurse, really just, if I just go meet up that doctor, really just, and you start by being already very arrogant. It's true, we can do better, and we will love your feedback. There are boxes in the hospitals for suggestions, so you can actually get to the hospital and you give. Musicians say problem when you finish. So we have so many problems, but maybe it's a short of solutions that we don't have. If you think we are not getting something right, you can write your suggestions and you put them in the suggestion boxes, and definitely you will be that person who is playing his or her own quarter to ensure that our healthcare services are better. With that said, we have also said that we have Clara that is offering home health care, and we are ensuring that we close that last mile of care to ensure continuity of care in the communities. If you want to be proactive about your health, if you have a sick one that needs prolonged or continuous care and you cannot remain in the hospital, if you have that person who needs to be in the hospital and you don't have a carer because all of you are busy, Clara is just a call away, and we can be able to make that happen. Thank you very much.
How should somebody get?
Oh, to get to Clara, 677-924162. 677-924162. Or you visit our website at www.clara.com. You can be able to get to us through those different options. Thank you very much.
Okay, thank you very much for coming to the program. It's a pleasure. It was really a wonderful discussion, and I believe that a lot of people have learned from what we said here today.
Thank you.
And also, if you don't remember the number or the website, just come to High TV. We'll tell you where you can find doctor, and you get those services. That's how we saw it on this edition of the program. Stay tuned to High TV. Join us again next week for another edition, and stay blessed.